Medical Association in Apana, and I request Dr. Murli Mohan to please present a bouquet to.
Thank you, Madam. Commissioner Police. Good afternoon, everyone.
Good afternoon.
So it has always been a pleasure for me to meet doctors who take Hippocratic oath to safeguard our lives, sometimes at the risk of their lives. మేము అనుకునేవాళ్ళం ఏంటంటే only police officers, army officers will risk their lives to safeguard their patients or their clients. It's not true. I have seen it in COVID times. Many doctors laid down their lives to do the service to their clients and save many more lives. I have seen it before my eyes. The DG Fire Services. First COVID time, you know that Swarna Palace fire incident. Mr. Dr. Ramesh has started it. And it went on flames because of short circuit. And about 10 people died. It played havoc with our healthcare system. The most important incident which was etched in my memory. Thank you. The important incident that is etched in my memory is that many of the patients from Andhra, today's Andhra Pradesh, wanted to access medical facilities in Hyderabad city. They were traveling in ambulances, and heartlessly their ambulances were stopped at Kodada and also at Kurnool checkpost, and not allowed to enter the territory of Telangana, which was part of our United Andhra Pradesh. And ironically, most of the hospitals in Hyderabad city are state.
I welcome my Honorable Commissioner of Police.
Just for this state. Welcome Shankha, Commissioner of Vizag City Police. He has been one of our illustrious officers in the Indian Police Service and my junior colleague. I am proud to sit along with him in Vizag City, which is my alma mater. I studied in Andhra University in the College of Engineering, and I have long association with this city. So having said that, this 7 Hills we had an accident, fire accident in the hospital, and also in this very hospital there was an operation, in operation theatre there was a fire incident, and I just visited coming from 7 Hills Hospital, what happened there.
Medical
I didn't visit that. I will see that. So what I learned is this is because of the short wiring. Because I asked one simple question: when did you last change the electrical wiring? So he is recollecting in 2008 they might have changed. Since then to today, it is 2024. That means about 16 years. 16 years. If you look at my notification on hospitals, gazette notification on hospitals, I have put electrical safety checklist. In that electrical safety checklist, one of the point is every 10 years the electrical wiring to be changed. Especially in those rooms where there is air conditioners, MRI, X-ray, ICU units are there in hospitals. Had it been changed, both in this hospital, where in the operation theatre there was a fire, and in that Seven Hills hospitals, where there was a air conditioner, and they didn't change the wiring for the last 60 years. If they were to change the electrical wiring simply, this accident would not have happened. See, hospitals particularly we consider as a vulnerable public places. Because by nature of hospital means people who are sick, crippled, unable to help themselves, under severe disabilities, under anesthesia, they are convulsing in different conditions. Many of them with IV fluids and machines connected to their body. It's a very critical and serious conditions. So therefore, in case of a fire incident in such locations, it's practically very difficult to evacuate these crippled people. Able-bodied people themselves are unable to evacuate themselves in certain serious conditions. But what to talk about? So that is where the public interest comes in. That is where the public interest comes in. So, see, what I would like the doctors community to think about, we are not here to lecture you. We are not your bosses. You are a specialist, just there are many specialists, heart specialists, kidney specialists and ortho specialists. So we have some special knowledge in this field of fire safety. I particularly have gone through many case studies of hospital fires across the country. And in my case study analysis of all the hospital fires across the country, 90% of them are due to electrical short circuits. Even in Andhra Pradesh, in the short period of last 5 years, Swarna Palace, which was the most devastating fire, it was because of short circuit. And what happened in this hospital in the operation theatre was because of the short circuit. And I don't know about Medicover though. So it is because of that.
Recently, another important fire accident took place in a coach, sir. Purva Express.
That is also electrical short circuit. So that is why we have sat with the experts in electrical engineering. I myself an electronics engineer, but I have sat with experts in electrical engineering. It is not a part of NBC. NBC is just advisory. If the advices are not suitable to you, you do not follow. And if some advice is not there, does not mean that if it is useful to us, we should not follow. So it is only a guidance to me. As a DG, under the DG satisfaction, I have notified. And they are very easy to follow. All that I have said is for every floor, there should be electrical micro circuit breakers. In the Seven Hills, it wasn't there. Why every flow? Because it responds to overflow of current in every flow, and it is a compartmentalized. To come the moment you are doing any expansion, new building and all, and they will install all this stuff. The point what I am trying to make is, does that equipment stop electrical short circuit fires? In fact, if you put water on an electrical short circuit, it will compound the matters. And why don't we take care? You have a heart established, and which cannot be used by anybody who happened to be present at the time of accident. Second thing, we are not bothered about taking care of the root cause, which is a heart problem. But we want an orthopedic surgeon to operate on the knee, not even on the heart. That's exactly what we are trying to do. So that is why when I studied the whole problem, it is the electrical short circuit. All that you have to do is to change the electrical wiring. That is unfortunately unseen, concealed. Like our heart vessels, they are not visible. They are getting blocked or not unless you see that angiogram. You don't know. So therefore I am going merry-go-round, that I am all right, fine, today I can run. But tomorrow itself it can get blocked, I am drop dead. In fact, last month one of my classmates, batchmate, who used to run along with me, he didn't even retire. He dropped dead in the morning. Along with son, he went for a jogging, he dropped dead. Lot of advice and a very sincere fellow. Why did he drop dead? Because it isn't visible unless you get it checked up. Same thing with this wiring continuously. We have brought, the AC has become cheaper and it is a sultry weather. Naturally, you want to buy AC and plug it. What will you do? You don't think about the wiring that has to carry the power to that AC. We just have a plug point and we just plug it. Whether that horse is capable of carrying the 5000 kg when it was designed for 50 kg. The horse can carry 50 kg, but we are putting 5000 kg and asking it to carry it without breaking its neck. And we have been using large number of machines. In the medical field is continuously advancing. We obviously want to enhance our health. So naturally large number of electronic gadgets are coming up and you are plugging in. Your hospital was built some 20 years ago. We never look into those vessels which carry the current. We keep on plugging. So when the weight becomes too high for that horse, sources, and they can go blast or they can leak. And if they leak into a room, and just switching off a light will be a spark, and it will go into flames. And a lady called Madireddy Rani.
Right.
I am Madireddy Pratap. Many people think that she is my mother, and she died in one such accident. So the cooking cylinder was leaking, and it is in the kitchen set. All the three things are required for ensuring hospital safety. My submission is, kindly read them. Because it's after all your hospital. And I have seen many of the doctors staying on the top of their own hospital. And at the bottom, it is the patients. So what does it mean? If there is anything wrong, you are the person who is going to pay the heaviest price. And I in this regard, sir, may I submit that in Tirupati, there is one doctor along with his kids and Manohar. They have all died in Renugunda hospital, if you recall. And unfortunately, there are too many middlemen, including many of them are sponsored by our own officials. Unfortunately, the thing to me is that there are 7,000 hospitals, twice or if not 3-4 times that many doctors. They are not illiterate, highly educated. Earlier you don't know what is NBC and all that. NBC is just advisory document. It's not having any statutory backing. That also I have clarified. Not just I have clarified in writing in the Gazette of Andhra Pradesh, but also I have included should not sprinkle on them. What I did, you don't know, maybe. I have written in the Andhra Pradesh Gazette that they should not be sprinklers. Where it does harm. But being educated so much, being well versed, At least you should question on behalf of the community of IMA. I have given it in writing. It's a matter of publication. It's not a secret document. And as for that, I have signed thousands of embassies. So basically, sir, if you don't protect your interests, if somebody is harming you, it's okay. Let them harm me. Still, I will not raise my voice. Somebody is administering poison to you, no problem, I will drink. If this is the attitude, nobody can help India. You are not illiterate people. My request is that you should read the basic things that I have been suggesting it to you. And my request is that you adopt them not just in our hospitals but even in your homes. My request is to just change a couple of things. And if something exits and all that, when some things you find it impossible, come back to me. We'll discuss and find a new solution. Because the law says that nothing impossible should be imposed on you. Of course, some unscrupulous guys, they will say that no, you must do it. Otherwise, I will write a report and you are going to jail. You are not going to jail. I am not here to punish you. I am here to find a collaborative solution which is practical enough, which is affordable enough for you, so that you continue your practice with more safety. We together work and collaborate to push the horizon of safety for patients as well as for your practice. And I want you to tell as if it is my words. We are part of community. One person tells just 1,000 people. If those 1,000 people tell another 1,000 people, just one person knows 1,000 people and he tells them and they tell another 1,000. You know how many people are covered? 1,000 into 1,000. 1 power 6. A million people. It's not less, sir. If 2 more persons, another million. It's like that. A safe environment. And the public service is there to help you, sir, in times of need, not to rob you. These people are hired to serve you, not to rob you. We are letting too many places, many people do so, sir. If that is so, India will never progress. Don't put sprinklers in X-ray theatres, MRI rooms. If you have put, I want you to forthwith remove them. And don't need to put the sprinklers in the parking lots because they will never work. Just put an attender and an alarm so that everybody knows about it. Okay. You understand? Because I believe what is practical. I don't believe in fancy stuff which doesn't work, which costs you money. Maybe it enriches some stupid fellow. I don't care. That's not my job. My job is to protect public interest. That means your common interest. Public interest is not diverse from you, sir. It is your common interest. Please help me to help you. All these pipes, if you remove it, I'll be more than grateful. Because if you keep it, after me, somebody will come and pester you. You simply put the bathroom pipes are there. Just connect them outside also, corridor. And put these pumps, which I have given you. And then give them a box. The same box which you put for that You put it there. So that when this box is there and it is working condition, nobody can change it. And it costs only 30,000 rupees. And it's such that, and you connect it through alternative generator power, main, lift generator power. So that even if the power is off, they will work. And they will always work. If they don't work, all that it means is it's like a use and throw syringe, which we have been using. Just throw it out, 30,000 and replace it. Enough. At least 10 years before, more than 10 years it should not be there. These are the most, whether there is a problem, I have no opportunity to attend this meeting, as if it is my word. Okay, sir. And let us work together to make these things better. Better for all of us. Thank you, sir.
He had the satisfaction.
But that time theme was different. Today's theme is entirely different. We spoke in a different level.
Yes, sir.